Prescription Painkillers, Drug Unit Capstone Project by Taylor Hibel, Miss Posick, Period 6. Every day, upwards of 1,000 people end up in the emergency room for misusing prescription opioids. Prescription painkillers are drugs that interfere with the nervous system's transmission of pain signals to the brain. These medications change the way that the brain receives messages so pain is no longer perceived as painful. These drugs stimulate the portions of the brain associated with pleasure, so along with relieving severe pain, they produce a high and euphoric feelings, meaning they're extremely addictive. Opioids, or opiates, are often contained in prescription painkillers. Opioids are powerful narcotics that, under a doctor's supervision, can be effective, but there are serious risks associated with using these drugs. Some of the most common opioid painkillers are Percocet, Roxicet, oxycodone, Vitacodone, and Meperidine. Short-term effects of prescription painkillers can vary. These powerful and dangerous drugs can be deadly when taken at high dosages or with alcohol. Even a single large dose may cause difficulty breathing or death. Short-term effects of these drugs include lack of energy, difficulty concentrating, and nausea/vomiting. Long-term effects of these drugs can cause addiction, overdose, and even death. Physical dependence and tolerance can occur. Withdrawal symptoms will occur if the person stops or reduces the presence of these drugs. A suppressed immune system and frequent constipation may occur. Prescription painkillers can interact with other medications and cause serotonin syndrome. Signs and symptoms of abuse can include allergic reaction symptoms and signs of serotonin syndrome. Signs of an overdose include shallow or slow breathing, convulsions, nausea, vomiting, stomach pain, and cold and clammy skin. If someone you know or you yourself are dealing with an addiction problem, there are multiple outlets for help and support. There are private and public, even luxury prescription opioid addiction treatment centers/programs available all around the world. A physician or doctor can also provide a referral for effective treatment. Peer pressure often drives people to use drugs for the first time. There are a multitude of strategies to avoid negative peer pressure to use drugs. Teens should choose to spend time with positive role models and avoid those who make poor choices. In addition, to respond to peer pressure to use drugs and make good decisions, people need to have reliable information on the dangers of prescription drug abuse. Wendy Liberman Davis was 17 when she took her first Vitacodone after her doctor prescribed it following surgery. The first pill made Wendy slightly nauseous, but it also dulled the throbbing sensation in her knee, so she took another one as instructed. This time, a warm, tingly feeling swept through her body. The feeling only lasted a few blissful hours. Wendy was sad when the bottle was empty. Wendy's life went on and she continued to use various drugs. Wendy eventually turned to harder prescription and even non-prescription drugs. She continued to abuse drugs, but she was caught by an observant doctor. Getting caught did not stop Wendy, as she then turned to stealing her beloved drugs. She only sought treatment when one night she thought she overdosed and was forced to admit her problem. Now Wendy speaks about her addiction and helps other women overcome prescription drug addictions. And these are my resources. Thanks for listening.